Everybody. So some of this material you will know because you're living it, and it was kind of designed for the extended family members, but I think you're going to find value of it too. But just wanted to kind of throw that out there. It will help you, have the verbiage and the words to be able to communicate it to them better, I think. But some of it you will know. All right. So does anybody remember as a kid playing that game where you're on a sidewalk walking and the saying goes, don't step on the crack or you break your mother's back? Yes. Yeah, I remember doing that as a kid in elementary school, and it was a lot of fun, and I try hard not to step on the crack, but I would sometimes, but obviously I would know that I wasn't really actually going to break my mom's back. But kids that are really young, like toddler, preschool, they don't have that ability to kind of know those types of things. Like, they will actually believe if you step on that crack, like, you're going to break your mother's back, which is kind of horrible to think about, believing that and thinking that you caused something that serious. But in terms of a cancer diagnosis, you think about how they make those connections, and if they run over their toy with their toy Jeep, and that's the same day they get the cancer diagnosis, in their minds, they're connecting these two things that are not really related, right? So they will think, okay, well, if I run over a toy again with a Jeep, then that's going to make me have more cancer, or my cancer's going to come back. So at that young of an age, there's that, just immature, magical thinking that happens that sometimes can really, superstitious thinking can really kind of throw everything off. So whenever I think about really young kids, I think about, developmentally, how does cancer affect each of those developmental stages? And, at that age, kids are really trying to broaden their circle, right? Really, up until that point, it's usually like central mom, right? And then when they get to be preschool and toddler, they're trying to broaden that circle, and they're trying to really get close to grandparents and aunts and uncles and friends and teachers. But cancer really throws a wrench in that, right? Because they can't broaden that circle. Mom's hospital or home, and they don't really have that opportunity to really get in preschool and build those relationships, which is really throwing their development off, because that's really something that helps them. In terms of emotions, I think at that young of an age, probably more confusion and fear I see, where I don't really understand this whole cancer thing. Doesn't really make sense to me. I just know a lot of people are acting really weird and serious and crying. Or it's, I'm fearful because I don't want people to like put my port in or poke me or, hurt me in any way. And then that fear kind of kicks in. I don't want to be separated from mom or dad. And, that's really when you get that strong emotional reaction. When kids that young come to see me, I'll use some play kinds of things to get them to kind of express how they feel about those types of medical procedures. I brought a play hospital, where you've got like doctors and things like that in there. And a lot of times when kids are feeling a lot of strong feelings, they'll take their toys and reenact really how they're feeling inside, right? And the reason they do that is they're trying to get control over a very helpless feeling, right? So they're trying to, okay, I can't control what's going to happen to me medically. I can't control what's going to happen to me when I get to go back to school or when I get to get out of this house. But I can control the narrative if I'm playing it out with my toys. I can control what happens in the story, and the ending can be what I want it to be. And so if you... Oh. Was that me?
It's mine.
Oh, your phone, okay. I thought it was something that I had on me. Okay. Okay. Oh, yeah, I didn't get my outline up. Okay. Okay, there we go. So what? You're okay. Yeah, you're fine. You're fine. So one of the tips that I have is just to really have those toys accessible to kids that young, so that when they really are trying to get mastery and control over that situation, they have, the play hospital, the dolls, and they can, you can sit there with them and really, allow them to kind of narrate the story in their minds and get a sense of control over what happens in the end. And that'll alleviate some of their helpless, fearful feelings. So you also want to dispel any myths they have, that superstitious thinking about cancer. And, I think keeping the discipline and the routine is great if you can do that at any age because of that consistency, predictability, and security. But I think more so at that young toddler preschool age is more important than other ages just because it helps them more. And anytime you can really give them more choices in life in general, I mean, there's so many things that they feel powerless over and out of control. So things that you just create choices that really weren't even a big deal to start with. But, do you want to do A or do you want to do B? But really, it's, you were going to let them choose anyway, but you make a big deal out of making and having choices for them all the time. So moving into a little bit of an older age group, maybe 6 to 12, developmentally, they really want to be good at something. They want to master something. They build their self-esteem based off of, can I hang my hat on, hey, this is what I'm good at. This is what I can accomplish. And they really start getting interested in, do friends like me? Where do I fit in? And even though they can understand a lot of this medical information, it's good to check in with them to make sure that they have an accurate understanding because they might feel embarrassed to really miss the mark and not really understand what this cancer diagnosis really is. And so if you can have them, draw a picture of what they think cancer is or have them explain it in their own words and just continuously come back to it and update the medical information and kind of rehearse it and go back again just to make sure that they understand. Because if not, they'll kind of go worst case scenario, like I'm definitely dying no matter what kind of thing. At this age, kids are, when they're going into a medical procedure that's painful, they'll usually do one of two things. When they're trying to cope with it. They will either distract themselves or they'll try to think about it differently. And I think as caregivers, one thing we can do is really help them work through those catastrophizing thoughts, right? So not to change them, maybe validate, have them say yeah, I think this is it. I think I am really going to get hurt. This is going to be horrible. Validating it, but, offering some other verbiage. We do hard things in this family, and this is going to be hard, but you're going to be fine. Giving them some slightly less catastrophizing thoughts can help before they go into those medical procedures. So let's talk about school. And I'm sure you've heard the term cancer brain. A lot of parents that come to see me, they say, before cancer, my kid was a really good student. They could solve problems. They, were just really sharp and just really had that ability to process information really well. And then, man, you see them go through the cancer treatments and things have changed a lot. You see more fogginess, slower to solve simple problems. Maybe they can't focus for more than 5 minutes on a task with school. And, it's wait a minute, this is how they were before, this is how they are now. This is two totally different kids here. And now we've got to kind of take a step back and figure out what to do academically for them to really help them get their needs met at school. Cancer brain happens in 1/3 of all cancer patients, and research is showing it's not just chemotherapy that's causing it. Other cancer treatments will too. And even just at the diagnosis, some people are seeing that it happens immediately. It could happen immediately or it could happen years after treatment's done. So there's a kind of a continuum of when it can kind of kick in and how long it lasts. And I think the age group that's most affected by this would be the younger kids, because that brain development's really formative and there's just so much that's malleable and going on during those early years. I think some parents decide to keep up with the schoolwork and, kids kind of stay on track. I don't tend to see that with the younger kids. I tend to see that more with the teenagers because sometimes they want to give the teenager a choice, and that's what they want to do, and they really want to push themselves, and that's kind of part of their identity. And other parents, they may say, we're taking a break from schoolwork completely, or we're going to really taper it down and not do as much, just to kind of limit the stress and the time, and devote it to health instead of schoolwork. You've probably heard of an IEP, and there was a law with the Individuals with Disability Education Act that said that legally all kids have the right from ages 2 to 21 to have an appropriate education tailored to their needs in any public school. And so what that means is if your child goes from doing okay in school and now all of a sudden they have this cancer brain from all the treatments, then having an evaluation will help determine, how much of an impact the cancer brain is having on their learning, right? We want to know, are they processing a lot slower? Are they having issues with memory? What's their focus like? And that evaluation then a springboard into what is an IEP, which is an individualized education program. And that IEP is what helps them get the accommodations in the classroom, helps them get their needs met in the school. So that is a route that a lot of parents take. Some parents do the homeschooling route or the hospital homebound, where you can have a public school teacher come into the hospital or the home and do all the teaching for you. And I think extended family members, one thing that they can do to support you guys is just to kind of have understanding that, this child may have a different way of processing information, in their brain that was different before compared to how it is now, right? And with that in mind, there may be a different route academically for that child than was previously routed. And just having that acceptance and understanding that things are going to change in that domain, I think could really be helpful if not only that they understand, but they could be helpful in the manner of, hey, do you need me to go with you to an IEP meeting? Is there any kind of research you need me to do on this topic to know what kind of accommodations are good for this type of issue? And do you need help finding someone to do the evaluation? So sometimes that could be a way they can chip in and help when it comes to the school system and the IEPs. Can you guys hear me? It's kind of slow. Okay. And I think other ways that extended family members can help you guys is to support friendships with the kids, and maybe that's shuttling kids back and forth to the hospital for visits, or gathering cards and letters from school to take to the hospital, because friendships are now more important at the school age than they were when kids are younger. This may be a time where kids are wanting to explore their faith in a negative or a positive way, just kind of expecting that they're going to have a lot of questions and a lot of thoughts about their faith. Extended family members can also come up with, just kid activities, things that, art projects, playing games, doing bike rides. They can kind of chip in and make sure that there's some normalcy there and offer to do those things for the kids. Some kids, when they are having really strong feelings, they have a hard time communicating what they're feeling. And, like adults, we can articulate it. We have a bigger feelings vocabulary, and a lot of times kids either don't have the feelings vocabulary, or they might have the feeling in their head, but they can't pull it out of their mouth. It's too intimidating to say. And I think one of the things that can be helpful is if there's some way for them to communicate how they're feeling, whether it's all right, well, I can see it on you that you're struggling, right? I can tell, you can see it on your kid when they're overwhelmed or when they're really distressed, and if you hand them some way, these are feelings flashcards where it's got opposite feelings on each side. If kids have things like this just kind of lying around, they're more apt to use it. And, if they're holding up the nervous feeling, or something that's uncomfortable, and they're in the hospital, and there's a visit plan from maybe an aunt's coming to visit them in the hospital, that visit might need to be canceled or delayed or cut short. And I think it's great if they understand that that's going to be a possibility and that it's nothing personal to them, right? But it's just kind of part of the whole process to really meet the needs of the child and going through emotionally. And, you know, something that's more simplistic is even just like taking a paper plate and you have like a smiley face and a frowny face on each side, and then they can kind of turn it, right, to kind of show how they're feeling. And it doesn't really require them saying anything, but sometimes just that nonverbal sign can communicate enough to you to know really that they, where they are emotionally, and then you can kind of go from there to know, all right, well, let's figure out what we can do to help you now that I'm knowing that you're struggling and feeling sad, and you know, maybe I can give you a hug, or maybe we need to kind of get your blankie, and you have some different coping strategies that you can point them to. Let's see. So let's talk about teenagers. Like, I could probably do a whole speech just on teenagers and themselves because I think, does anybody have teens in the room? Okay. All right. Yeah. You know, cancer really does throw a wrench in their system, right? Because developmentally, teens, they're like on the brink of adulthood, right? They are ready to go out in the world and find out who they are separate from their mom and dad, and find their own interest and their own set of friends, and apart from mom and dad. But as you know, that's really difficult to do all these outings away from you, and there's a lot of more risk involved in that. And so I think it really does affect them quite a bit that they aren't able to kind of have that friendship connection because they're in the hospital or their counts are low and they can't have visitors, right? So they are trying to form an identity, and they're more like future-minded than the younger kids. Like, so they're thinking, how is this going to affect me? You know, I can't perform at school, so is that going to affect what I do? Can I get into college? What about my career? Can I have kids one day? Will I be able to get married? I'm not able to ever kind of get out of here and meet people, right? The older teens, they're thinking about these long-term, like existential, like big types of heavy-weighted stuff. And I think at any age, the hair loss is really extremely difficult, but for them, probably affects them more than any other age group, right? Because they're finding a lot of their identity in what image they project to everybody else. And so that's really difficult that they don't have control over that image that they're putting out to the world. So, and then another thing is that they are risk takers, right? They're going to push the limits. They're going to do things to just see, like, what's going to happen if I step over this limit, this rule, and break the rule. That's just kind of what they do. They test the limits. Some of them might drink alcohol or get involved in like really aggressive contact sports. But those risk-taking types of things are so dangerous when you're going through cancer treatment that it's like, okay, throwing a wrench in that development, right? They can't really take those risks and kind of push those limits like most teenagers can. And so that really just sets them back. And I think a few things to support teens would be, you know, just encouraging that goal setting. Like, let them dream, think big, talk about the future, talk about what's to look forward to and what they want to be when they grow up and what life's going to be like. And, you know, just go down that rabbit hole with them and giving them something to fight for, to live for, to really kind of look forward to doing those things in the future. Also, you can, like we said before, with the friends, shuttling them back and forth. Sometimes teens really care about like trivial things that don't seem to matter to us, that kind of seem silly, like makeup and nails and all that. But, you know, like just giving them those silly things to care about, because that's just a distraction for them to be able to really not think about the serious stuff going on and not really downplaying it, just allowing them to have those trivial things and interest and being okay with it. And just, allowing them to vent and without passing judgment and you know, their need to fit in and belong to a peer group, they're going to complain a lot about that they're not able to kind of find their group, find their people, and just trying to empathize and validate that, yeah, I get that. That's really difficult, and that's normal that you're having those urges to do that, and that huge frustration that you can't. So I want to talk about a topic that is not really age specific, but it's more affecting all age groups, and that's dealing with the steroid effect, right? A lot of people have been there.
About steroids.
Yeah.
6 days to steroids.
Yep.
6 more days.
6 more days. And we're on the same exact we go to
Regimen.
the doctors at the same time, both of
Yeah.
our kids, and
Oh wow.
they get the same treatment on the same day. So like,
Wow.
I double check with her. I'm like, this is what we're doing.
So you're in
Yeah.
sync. Get your plan like in sync, right?
Yeah.
I tried this, it didn't work. I
They
tried
end in
this.
May and we go till August. So
Okay.
We're like one more cycle longer than them, but it's like the same exact.
Countdown, right?
So yeah, so in 6 days we have to do the steroid thing, and our girls get crazy.
Mm. Yeah, the Hulk, right?
Is this where I make the female jokes? Crazy. No, it's cool.
Next.
Red devil,
So a few years ago, I was at a playground and my kids were playing, and I was with a friend, and her kids were playing, and there was this kid that looked maybe 6 years old, and she was having a bad day, like not just any old bad day, but the kind of bad day where if you were an adult, you'd want to like crawl back in the bed and like put the covers over your head. I mean, she was pushing kids down. She punched her mom in the stomach. She was just kind of like wallowing around on the ground. And then when she wasn't doing all that, she just was walking, kind of shuffling around, making these moaning and grunting noises, and had like kind of this blank stare in her eyes. And I was like, wow, like my thought was, okay, I'm really feeling sorry for the mom here, because like she's got her hands full, like that's really tough. And then I'm thinking like, are my kids safe? Because I mean, she was just punching anybody, right? But my friend who was with me, she's like this, just kind of tell it like it is kind of friend. And she was like, that kid needs to, get some discipline, right? Like that mom needs to get a backbone. They don't need to have her out in public like that. And I I was like, ooh, I don't know.
Yeah, what she's going through.
Yeah, you don't know what they're going through, right?
You don't know what the parent is going through with that kind of stuff. Because my daughter is not even 3, and I've been bit in the face. I've been scratched. I've been accused of child abuse because she was screaming so loud in the supermarket, and apparently I must have done something to make her lose her shit to the point where she's breaking my necklace and scratching my face. But they don't know, and she's not even 3 yet. So she's already dealing with.
And it's not only the steroids, combining all the medications. My daughter said that she forgot half of the stuff that she was seeing in the hospital.
Wow.
I don't remember that.
We're just getting angry because they have to take medicine. Like,
Right.
they're like just getting mad because she has to. She's like, this sucks for me and I hate it and I don't want to do this, and just anger forever.
Yeah,
Having cancer.
for sure. And the younger kids, it's a little bit easier to kind of force it, but with teenagers, when that risk taking, that rebellion, I mean, that's one way that they show rebellion, right? Is like, I'm not cooperating, I'm not taking that medicine, like this is how I'm pushing that limit. But so with my friend, as the family was walking away, I read the back of the t-shirt of the child that said like cancer strong.
Yeah.
Right? And I realized, like, in that moment, like, that's what's happening. She's having that steroid reaction right here and right now. What the same thing that's happening.
You understood because you are involved.
Yep.
Yeah.
When parents are there,
They have no idea, right?
They just think you can't handle your kid. They
Right.
just think that you're a terrible
Right.
parent.
And maybe even extended family members, right? Like, are you disciplining your kid, right? That could happen. There's judgment there, even without really understanding that is a physiological response to this side effect of this medication. But the friend that said what she said, she felt really remorseful when she realized what she said, and then it was like, wow, I feel really bad that I prejudged these people and I didn't really know what was going on. And I think that that's really very common in today's world. I mean, you just see this kid just throwing a fit, and you just kind of make assumptions, or people make assumptions, right? That they know what's going on. So let's see, what else? I think showing compassion to parents and kids in that situation, And if there ever is a time for extended family to chip in for childcare help, that's the week, right? The steroid week. I mean, you know.
That's the week they decide they've got so much to eat. That's the week that they're like, you know what?
Yeah.
I've got something.
Right. So if there's anything they can do to take things off your plate that week, I mean, to show up there would mean so much, to be able to just be an extra set of hands, or, you know, be that calm voice in that storm or tornado of, you know, your child turning into Hulk. So I think that's going to be helpful if they can chip in. If they are part of that and they're caring for the child, or you're caring for the child, you know, there's some things that you can do to try to counter that Hulk coming out, right? There's lowering the lights, decreasing stimulation, not making plans to go out, you know, staying home and really keeping a calm voice, even though you've got a screaming voice screaming at you. I mean, that's easier said than done. But I think, you know, if your frustration's matching their frustrated voice, it's going to kind of counter it and escalate it, right, and make it a lot worse. So I think being mindful of the tone of voice is good, and giving that child, you know, that kid-proof space to rant and rave and kind of get some energy and some movement out. And then if once they're ready to crash, you know, allow them to kind of zone out in a movie, you know, and you're not worried about too much screen time. You're not worried about that they've been jumping on the trampoline for hours and hours and hours. Like, you're doing what they need, and it may not fit into what is expected or it's done by other people, but that's kind of how it goes. And then also, there may be some shared phrases that can kind of help, you know, be a shortcut to kind of like get them to snap out of it, right? Like when they're not in steroid treatments, if you practice and rehearse some things like, okay, when I say the Hulk, you know, this is the plan, this is what we do, and we kind of rehearse it. You know, it's not going to work all the time, but it's kind of like muscle memory, right? If you rehearse something a lot of times, you can go on autopilot mode, and sometimes it feels like you don't have to think about what you're doing, but it's just kind of already memorized in your body. So having some verbiage that extended family members know about that's shared amongst all the caregivers might be helpful, and the kid knows as well. So, you know, I think we've covered a lot of information about the child that has cancer, but I think it's really well worth our time to talk about the well siblings, because there's such a huge part of this process, and there's a lot of emotional things, relational things going on with them. You know, they have a lot of the same fears that the kids with cancer do, you know, that this child's going to die, their sibling's going to die, that the parents are going to not be available when they need them, and they're going to be so absorbed right into the medical caretaking that the instability of the fear, right? Like, they don't know, like, who's going to pick them up from school that day. They don't know when they're going to stay with relatives. They don't know if their play dates are going to be canceled. They don't know if their birthday is going to be canceled. And so that brings up a lot of nervous feelings because they really can't predict. They went from kind of knowing the gist of things and predicting to all of a sudden they can't really predict, right? And that's really difficult. I think angry, right? Because it's like, I didn't ask for this. Like, I didn't sign up for this life. Like, life's not that good right now, and I'm kind of mad that this cancer just showed up. And, you know, I'm not the one that maybe is getting exempt from chores or getting exempt from schoolwork or getting mom and dad all the time, you know? So I'm feeling like I'm getting kind of the short end of the stick here because I'm still going to school. I'm still doing my normal thing. And, you know, I'm pretty angry about it. And it could be jealousy too, kind of mixed in with the anger, right? Like, hey, you getting showered with gifts? Like, we've been going through this. I've been doing my chores, no gifts. Been doing, you know, like, wait, what about me over here? So, you know, they're grieving losses too. They're grieving that carefree childhood. They're grieving that sense of normalcy and being able to kind of have that childhood where they can just kind of rest and know what's coming and not have to worry about what's going on with their sibling or who's picking them up from school. So, you know, I think in ways to support them, you know, we don't want to downplay all their feelings, right? Because with extended family members. If the siblings sharing their feelings and saying, I'm angry, or I'm jealous, or I'm sad because of this, this wouldn't be the time to say, but your sister's really going through this. It's so much worse than what you're going through, right? So you need to kind of get it together, right? So that wouldn't really be the time for extended family members. Are you hitting him?
I'm not extended family member, I'm Dad. So sometimes Dad has to lay down the law. Cancer, no cancer.
So, ways to support the siblings would just be, giving them that platform to really talk about their feelings and just reassuring them and listening and validating. And two, a lot of times they feel like they're expected to really pick up all the slack, especially the older Will siblings, right? Where they're having to, do a lot of babysitting and do a lot of chores. And not that they shouldn't pick up some slack, but I think it's helpful if maybe an extended family member can come in and fill in a little bit of the gap so that older sibling, Will sibling, can go out and have fun with their friends and do some of the normal, child development stuff. Another thing. Do you want to talk? You can talk if you want. You may read it?
Sure.
Okay. He says, I don't believe in feelings. Sergio.
That's her. They're like best.
We don't want really good.
Yeah. Okay. So humor instead of feelings?
No, I don't do feelings.
So
I was raised German Catholic in the Midwest. I
Okay.
don't believe in feelings. It's a rough life.
we have a very interesting situation. He was blown up on a mountaintop in Afghanistan a few years ago. So he has a really bad TBI that he's still dealing with. That was in 2009, after our son was born. We make the joke that we can't have any more kids or else one of us will die. Because our son was born, 3 months later he was blown up on a mountain. Our daughter was born less than a year. I was diagnosed with cancer. And then 4 months later, our daughter was diagnosed with cancer. So, we make the joke. We make inappropriate jokes all the time.
Survival skills. You've developed some survival skills.
We make the joke that we can't have any more kids because one of us will just end up dead.
Yeah, but I don't do feelings, and it's how you get through it, right? You fight through, you smash through.
We've had some issues because while I was going through chemo, our daughter was diagnosed, and we've had some issues.
Sure.
But to me, it's a terrible coping mechanism by all means. Stoicism is not where you want to be, but it gets you through life. I can turn off all feelings, all emotions, and make the world happen. Everybody's fed. Everybody's clean.
Basic needs are met.
You have a roof over your head, you have food in your mouth, you have clean clothes on, you made it to school on time, the dog is fed, everybody's alive.
And what you're describing is why we don't really see in our practice a lot of families going through the thick of treatment, because they put that Band-Aid on of we're not really going to look at feelings, and then when treatment's over, that's when it's okay, we're out of the survival mode, and now the feelings we haven't dealt with are really coming up and are bubbling up and really hard to handle.
It on for years.
So survival skill, you've got those survival skills.
He was born over 9.
But for me, it's a lifetime thing. I go to war for a living.
Yeah.
So it's
you're in the battle zone all the time. Yeah.
I wear a bracelet with 13 names on it. I got 3 more to add. So
this is a gentleman who'd rather go to Afghanistan and deal with that than deal with the fact that his wife and his daughter had cancer at the same time.
For anybody who's been to war is so much easier than real life. So I'm just put that out there. Yeah. If you've never been to war, sleep, eat, don't die.
Yeah.
Your thought process
dealing
is
with
really
the fact
simple.
that both me and our daughter, within months of each other, were diagnosed.
I think that's
so hard.
why you guys are strong people.
Yeah.
I'll be devastated.
You learn to survive.
Family members.
Fighters.
Oh, I'm devastated, but I just don't think about it. I just smash
This
through
is
life.
why I have no hair.
Just keep smashing.
Survivors.
Yeah, you just can't take me down.
That's good.
No, not at all.
You found a way to get through
Robot mode.
the crisis. It's worked for you. So
not real pleasant, but you know.
It's not exactly the best coping mechanism, especially when.
Well, yeah.
What?
Survival code, though. Yeah.
Oh my god! What happened? Especially when a wife wants a little bit more than, you know, being treated like, oh, you got cancer.
Well, here comes the chocolate. What a great transition.
Transition.
More sugar.
How about you support some siblings and you just pump your brakes?
I support our siblings all the time. Is that all for you?
I'm giving everybody their piece so that I can just have
Oh, two, Mom.
2 for you.
Just kidding, just one. I had a big 3 plates.
Small, medium, large.
Smallest.
Oh.
Sweets.
I'll leave you with one more tip for siblings, and then I'll turn it over to, well, I've got a few more things, actually. No, this is it. So I think the last tip that I will leave you with siblings is acknowledging their accomplishments and things that they're successful at, apart from what they're doing for their sibling, right? Apart from helping their sick sibling, you know, with their chores or whatever they're doing for them. I think helps them feel value and important, and helps them survive the hard times when we can do that. So that really covers how to help kids during all this, Leanne.